Rural communities across Idaho continue to struggle with emergency medical service care. That's according to the Idaho Department of Health and Welfare. Idaho law does not designate EMS as an essential service, so they don't get a lot of funding through the state. This week, Health and Welfare's Health Quality Planning Commission will talk about ways to help fill these gaps. News Channel 7's Tristan Lewis joins us in studio tonight with a look at how others are stepping up to help communities in need. Tristan?
Idaho Medical Academy trains about 500 emergency medical technicians each year. With its hybrid program, students can do the lessons at their own pace, even if they're hours away from Boise. They believe what hurts many rural agencies is people not having enough access to trainings and education. A medical emergency can happen anytime, anywhere.
You never know when you can come across somebody that needs this type of help.
To meet the need for this type of help, Idaho Medical Academy, based in Boise, educates and trains emergency medical service students all over the Gem State.
I live 3 hours away.
And the country.
So I work in Denali National Park, so I guide on Denali pretty much all spring season, so out remote in Alaska.
This is a first step for students who are interested in becoming in healthcare.
That first step could lead to working in hospitals, becoming a paramedic, working in a fire department, to even working on a ski patrol, says the Academy's director, Justin Rainey.
There's a lot of options they can do outside of the school, and we are just the introduction for healthcare.
With the school's online and hybrid classes, Rainey says they're able to help fill a need in rural areas of states where a lot of departments are volunteer-based and underfunded.
Most of their funding is from volunteers doing community events and stuff like that. When COVID hit, a lot of those community events went away, lost a lot of resources.
In Idaho, 69% of rural areas rely on volunteers, according to the Office of Performance Evaluations.
Because there's a lot of people who want to serve their community.
But the calling to serve isn't always enough when EMS education isn't readily available nearby, and bringing in an instructor can be too costly. Rainey says hybrid classes at the Academy can help fill EMS staffing shortage needs quicker.
So they might have one person who just needs to get their EMT, and they're like, hey, we can't put on a class, but they can remote in and take a class through us and get that person to become an EMT.
EMT student Colton Barati is taking his knowledge back to Twin Falls, where he is surrounded by different communities.
You got Filer, you got Buell, Jerome, Kimberly, Hanson.
He says as the Magic Valley grows, those smaller departments will need more help.
And so I think it's really important for maybe, hometown type of people that know the area real well and everything like that to help, the fire department or EMS or paramedics.
And today's class was actually a hybrid class where those students did their classes at their own pace online. Then they finally met in person this past week. In the past few days, they did exercises and practices and trainings at the Idaho Medical Academy office in Boise. And Doug, something pretty cool that they're utilizing in training is virtual reality. Students are able to get some firsthand experience in emergencies without the pressure, just the consequences of it actually being real.
But just about as real as possible through the VR. All right, Tristan, thank you so much.